Audiology, Wikipedia article Audio. Audiology is a branch of science that studies hearing, balance, and related disorders. Its practitioners, who treat those with hearing loss and proactively prevent related damage, are audiologists. Employing various testing strategies, audiology aims to determine whether someone can hear within the normal range, and if not, which portions of hearing are affected, to what degree, and where the lesion causing the hearing loss is found. If an audiologist determines that a hearing loss or vestibular abnormality is present, he or she will provide recommendations to a patient as to what options may be of assistance. In addition to testing hearing, audiologists can also work with a wide range of clientele in rehabilitation, from pediatric populations to veterans, and may perform assessment of tinnitus and the vestibular system. Audiologist. History. An audiologist is a healthcare professional specializing in identifying, diagnosing, treating and monitoring disorders of the auditory and vestibular system portions of the ear. Audiologists are trained to diagnose, manage, and/or treat hearing, tinnitus, or balance problems. They dispense, manage, and rehabilitate hearing aids and assess candidacy for and map cochlear implants. They counsel families through a new diagnosis of hearing loss in infants, and help teach coping and compensation skills to late deafened adults. They also help design and implement personal and industrial hearing safety programs, newborn hearing screening programs, school hearing screening programs, and provide special fitting ear plugs and other hearing protection devices to help prevent hearing loss. Audiologists are trained to evaluate peripheral vestibular disorders originating from inner ear pathologies. They also provide treatment for certain vestibular and balance disorders such as benign paroxysmal positional vertigo. In addition, many audiologists work as auditory scientists in a research capacity. Audiologists have training in anatomy and physiology, hearing aids, cochlear implants, electrophysiology, acoustics, psychophysics, neurology, vestibular function and assessment, balance disorders, counseling and sign language. Audiologists also run neonatal hearing screening program, which has been made compulsory in many hospitals in US, UK and India. An audiologist usually graduates with one of the following qualifications: MSc, O.D., ST, PhD, or SCD, depending the program and country attended. The use of the terms audiology and audiologist in publications has been traced back only as far as 1946. The original creator of the term remains unknown, but Berger identified possible originators as Mayer B. A. Shear, Willard B. Hargrave, Stanley Nowak, Norman Canfield, or Raymond Carhart. In a biographical profile by Robert Galambos, Hollowell Davis is credited with coining the term in the 1940s, saying the then prevalent term auricular training sounded like a method of teaching people how to wiggle their ears. Audiology was born of interdisciplinary collaboration. The substantial prevalence of hearing loss observed in the veteran population after World War II inspired the creation of the field as it is known today. The first U.S. university course for audiologists was offered by Carhart at Northwestern University, in 1946. Requirements. In Australia, audiologists must hold a Master of Audiology, Master of Clinical Audiology or Master of Audiology Studies, or alternatively a bachelor's degree from overseas certified by the VETASS. Audiologists in Australia are not required to be a member of any professional body but to dispense hearing aids to eligible pensioners and eligible war veterans as part of the Office of Hearing Services program. An audiologist must hold a practitioner number, which is obtained by obtaining a certificate of clinical practice and be registered with an approved body such as Audiology Australia or the Australian College of Audiology. A minimum of 1 year of supervised practice and professional development is required post-qualification to obtain this. In Australia, by general definition, an audiologist is a university graduate with postgraduate qualifications in audiology or equivalent training. Audiologists have broad responsibilities and expertise in all non-medical areas of hearing services, including complex hearing assessment and rehabilitation of hearing impairment. An audiometrist has completed a TAFE certificate course in hearing aid audiometry and/or received in-house training from the hearing aid industry. Audiology Australia, via the Code of Ethics and the Practice Standards, governs the professional practice of audiology for members of Audiology Australia. To meet these high standards, members undertake professional development to enable them to maintain appropriate skills and learning in their areas of professional practice. The purpose of the continuing professional development program is to provide a structure that enables members to formally document the ways in which they manage and extend their professional skills and knowledge. The Audiology Australia CPD program provides recognition and encouragement for the continuing participation of the members in high-quality professional development. The CPD program enables members to demonstrate to external stakeholders their commitment to the highest standards of professional competence for audiologists. The CPD program is focused on maintaining a high-quality practice of audiology and is tied to the Certificate of Clinical Practice. Audiology Australia members who are not engaged in clinical practice are not required to formally document their CPD and will not be issued with a Certificate of Clinical Practice. ACAUD members are required to demonstrate their professional competence and are assessed against ACAUD's professional competency standards. Recognized competencies are shown on a member's certificate of competency that is prominently displayed in the member's clinic and renewed annually. Australia. There are 6 universities in Australia that offer graduate programs in audiology for local and overseas students. All programs offered are recognized as eligible for membership of the Society, Audiology Australia and the International Society of Audiology. In Canada, a Master's of Science is the minimum requirement to practice audiology in the country. The profession is regulated in certain provinces: New Brunswick, Quebec, Ontario, Manitoba, Saskatchewan, Alberta, and British Columbia, where it is illegal to practice without being registered as a full member in the appropriate provincial regulatory body. There are currently 5 universities in Canada which offer graduate programs in audiology. Entry requirements typically include specific prerequisite coursework in undergraduate studies or an additional preparatory year prior to entry into the program and a competitive GPA in the bachelor's degree. The following universities offer the MSc in audiology. Canada. The Government of India established the All India Institute of Speech and Hearing, which has become the country's leading institute in the field of communication disorders since 1966. The second Audiology and Speech-Language Therapy program was started in the same year, at T.N. Medical College and BYL Nair CH Hospital in Mumbai. There are currently 20 universities in India which provide speech pathology and audiology programs. These programs are accredited by Rehabilitation Council of India. India. To practice audiology, professionals need to have either bachelor's/master's degree in audiology and be registered with Rehabilitation Council of India. Indian Speech and Hearing Association is a professional platform of the audiologist and speech-language pathologists where annual conferences are held. The educational institutions awarding degrees need to attain recognition from RCI. Presently there are around 70 institutions which offer at least a graduate degree in the field. Approximately 20 colleges offer higher degrees such as MASLP, M.Sc Audiology and Speech-Language Pathology. Few such eminent institutions in northern India are Guru Gobind Singh Medical College located in Faridkot of Punjab, Postgraduate Institute of Medical Education and Research, Chandigarh, Ali Yavar Jung National Institute for the Hearing Handicapped, Mumbai in Western India and many more. There are nearly 1,000 or more private clinics in India providing speech and hearing services. Malaysia. An internationally recognized degree, unique multilingual/multicultural background, excellent communication in English has increased the global demand of Indian audiologists considering the shortage of these graduates especially in Western countries. However, in recent times, the profession has been plagued by introduction of short-term diploma programs which has resulted in dilution of services particularly in hearing aid dispensing and there have been mass protests by speech and hearing fraternity to stop such courses and curb malpractices. There are only 3 Malaysian educational institutions offering degrees in audiology. United Kingdom. There are currently 5 routes to becoming a registered audiologist. There are 10 United Kingdom educational institutions offering degrees in audiology. In the United States, audiologists are regulated by state licensure or registration in all 50 states and the District of Columbia. Starting in 2007, the Doctor of Audiology became the entry-level degree for clinical practice for some states, with most states expected to follow this requirement very soon, as there are no longer any professional programs in audiology which offer the master's degree. Minimum requirements for the O.D. degree include a minimum of 75 semester hours of post-baccalaureate study, meeting prescribed competencies, passing a national exam offered by Praxis series of the Educational Testing Service, and practicum experience that is equivalent to a minimum of 12 months of full-time, supervised experience. Most states have continuing education renewal requirements that must be met to stay licensed. Audiologists can also earn a certificate from the American Speech-Language Hearing Association or seek board certification through the American Board of Audiology. Currently there are over 70 O.D. programs in the United States. Distance O.D. programs. Residential O.D. programs. United States. In the past, audiologists have typically held a master's degree and the appropriate healthcare license. However, in the 1990s the profession began to transition to a doctoral level as a minimal requirement. In the United States, starting in 2007, audiologists were required to receive a doctoral degree in audiology from an accredited university graduate or professional program before practicing. All states require licensing, and audiologists may also carry national board certification from the American Board of Audiology or a certificate of clinical competence in audiology from the American Speech-Language Hearing Association. Portugal. Audiologists are autonomous practitioners and do not need physician orders or supervision. However, many audiologists work in doctor's office and hospitals. The median salary for an audiologist in the United States is approximately $65,500 in 2008 according to the Bureau of Labor Statistics. Audiologists who earn over $98,880 per annum typically have their own private practice. University of Western Australia, University of Melbourne, Flinders University, La Trobe University, Macquarie University, University of Queensland. The exercise of audiologist profession in Portugal necessarily imply the qualifications degree in audiology or legally equivalent as defined in Decree Law 320/99 of August 11, Article 4. At present, the degree in audiology is administered in two schools. University of British Columbia, Université de Montréal, French instruction, University of Western Ontario, University of Ottawa, French instruction, Dalhousie University. Health Technology School of Coimbra, Polytechnic Institute of Coimbra. School of Health Sciences, Polytechnic Institute of Porto. University Kebangsaan Malaysia, University Science Malaysia, International Islamic University Malaysia. In Portugal, research in audiology is still undeveloped. Most work in this area is mainly on standardization and noise. At this time, students of audiology colleges may have relevant a role in this area as well as the professionals who attend master's degree and doctorate's degree. FDSC in Hearing Aid Audiology, BSc in Audiology, MSc in Audiology, Fast Track Conversion Diploma for those with a BSc in other relevant science subject, available at Southampton, Manchester, UCL, London and Edinburgh, BSc in Clinical Physiology available at Glasgow Caledonian University. All applicants must be NHS employees. Anglia Ruskin University, De Montfort University, University of Manchester, University of Leeds, Aston University, Queen Margaret University, University of Southampton, Swansea University, Middlesex University, University College London. A.T. Still University through Arizona School of Health Sciences, University of Florida.